dirt and a whole lot of very cold, rainy weather. And now when you drive by Noyes, there is a building that is essentially completed. Probably, I'd say 92% complete. And inside we have floors, wall covering, the air handling system is all being commissioned. And it really looks pretty much like a finished unit except for some small details. The opening is scheduled for sometime in June. We are going to have a ribbon cutting ceremony on June 6th at 10 a.m. We're very proud of what we're being able to offer to the Dansville community, and we're going to take every opportunity to show it off. As you can see from the diagram up on the overhead, the area in blue is the new construction, and that is 10,000 square feet. The area that looks like sort of an orange color is the existing emergency department, and that is 3,000 square feet. So we're actually a little better than tripling the size of space for our emergency department. What that does for us is that affords patients much privacy that they currently don't have in the space that we have now, as it's very small and our rooms are small. Also, we now will have 2 entrances to the emergency department, one for ambulances, as well as one for patients who drive themselves and walk into the emergency department. There are going to be 8 private rooms. They're all very good-sized rooms. And in those rooms, we put ceiling lifts so that our staff and our EMS personnel do not have to lift patients unnecessarily. And we're trying to make sure that we avoid all back injuries. I know you have this in the nursing home, and it is something we have to be very mindful of for our workers, that we ensure their safety. Also, as you come in near the ambulance entrance is a decontamination center. Karen, I'm sure, is very well aware of this. In our community, it's not just terrorism that we have to worry about. There's also, because of the farming industry, there's a lot of chemicals in use. So there are times that patients have to be decontaminated, typically in the field, and then a second time when they arrive at the emergency department. So this has an isolated entrance for decontamination. You can wheel a stretcher right into the decon shower and then come into the emergency department. So there's a lot of great advantages to this new emergency department. I'd like to give you an update on where we're at with the capital campaign. We set a goal for ourselves. Well, let me back up. We received a grant from the state, HEAL grant, Health Efficiency and Affordability Law for New Yorkers. That was $4.69 million. That clearly got us off the ground with this project. Our next step was to define a capital campaign target, which we set at $2 million. And I'm very happy to say that we are now approaching the $1.9 billion mark, thanks to our wonderful community. I would certainly be remiss in not thanking Phil and Carol Saunders, who were the lead donors for this campaign. Phil and Carol contributed $750,000, and this emergency department will be named after their daughter, Mary. And Mary passed away from a brain tumor several years ago. So we're very honored to be able to honor Mary's memory by naming the emergency department after her. Our next biggest donor was our auxiliary. And the ladies that run the coffee shop, the gift shop at Noyes, have pledged $305,500 to this project. And they will fulfill that obligation in 4 years. So that coffee is a great revenue. So when you come to the hospital, buy a cup of coffee. You will be contributing to the campaign.